Hello, my name is NURU642 and I am a doctoral nursing practice student and a psychiatric mental health nurse practitioner student with the University of Massachusetts Global. I'm going to be doing an integrative therapy video utilizing 3 different therapeutic techniques on one patient over multiple sessions. The 3 types of therapies that I'm going to be using are dialectical behavioral therapy, known as DBT, acceptance and commitment therapy, known as ACT, and interpersonal therapy. Patient X is a 51-year-old Caucasian male presenting for follow-up visits regarding a history of anxiety starting in his early adolescence. This is his 3rd visit. He is well-groomed but appears to be anxious when looking around the room often and changing positions frequently. He is married with 2 adult sons, ages 31 and 21. He has participated in marital therapy off and on since his mid-30s and has found it to be helpful. He has varying degrees of anxiety symptoms depending on his situations, and when he feels anxious, he will typically self-isolate, disengage in conversation or interactions with others, and occasionally become irritable or angry with occasional verbal outbursts, or people can perceive him as being aloof or rude. He has tried some medications in the past, such as fluoxetine and venlafaxine in the past, but there were sexual side effects and he does not want to take these medications for anxiety. He denies any history of panic attacks. He is also concerned about medications having interactions with other medications from his primary medical history. He is looking for alternative assistance in treating his anxiety. He does not ascribe to any organized religion, but describes himself as more spiritual than religious and states openly that he finds both value and problems with most religions. He states his family is open to him seeking therapy and is willing to participate in any way needed. He is concerned about the effect this anxiety might have on his ulcerative colitis. He also admits to having to worry about not being able to work or becoming sick and not being there for his family. He admits to worrying about what his colleagues might think due to needing to use the restroom frequently, or what they may perceive as he is trying to avoid work when he doesn't feel well with his UC. Significant past medical history includes ulcerative colitis, hypertension, insomnia, and a peptic ulcer disease that caused a GI bleed. He is allergic to penicillin, sulfa, and morphine, all provide hives, itching, and difficulty breathing. And currently his medications are trazodone 100 milligrams at night per sleep, Rinvoq 15 milligrams in the morning, prednisone 20 milligrams in the morning, mesalamine 375 milligrams twice a day, tramadol 50 milligrams 3 times a day as needed for pain related to his UC, losartan 50 milligrams in the morning, and metoprolol 25 milligrams in the morning. Dialectical behavioral therapy was created by Dr. Marsha Linehan initially for depression and borderline personality disorder, but was also found to be helpful for anxiety disorders to help the patient be more mindful and grounded during times of stress. It also helped them connect with how they feel in the present and acknowledge the feelings without being ruled by them, such as using deep diaphragmatic breathing exercises or guided imagery. This can be helpful in redirecting feelings of anxiety and provide distraction and be in the moment away from worries. Culturally, it stems from meditation and Buddhist philosophies of enlightenment and spiritual goals. However, a patient's personal religious background may not be accepting of this. If they feel a conflict with their own religious roots, then mindfulness and meditative guided therapy can be redirected to meet cultural templates without stressing the religious origins. We can take lead from the patient to teach them instructions to recall examples of kindness from others, natural environments, or sights, sounds, or smells that are comforting to them to make it more culturally applicable. We're going to be bringing in Mr. X at this moment so that we can begin this kind of therapy. Mr. X, hi, how are you doing?
I'm doing good. How are you?
I've been doing well. How have things been going since the last time we saw each other?
Well, I guess they're going okay. I've had some good days and bad days. Work feels much more stressful than usual, and I think this has made my anxiety worse. I've had a couple of days when I lost my temper with the people that I work with. Was too stressed out at work, I guess. So I did take a couple of days where I tried to work from home. So, and I was able to focus a little bit better when I was at home.
Tell me a little bit about the kinds of physical symptoms when you were experiencing the stress that you're talking about.
Well, people are so loud at work, at the office. They interrupt my train of thought. I don't really want to hear about what they did on the weekend or their days off. I just want to do the work and finish and go home. I feel like there are a lot of interruptions in my day, and sometimes by the afternoon, my patience has gotten thin. So sometimes I say things like, I'm not really interested in hearing what you have to say, or if it's not about work, please don't bother me with it. Those kind of things. I feel myself getting irritated on the inside as the day goes on. I start feeling, hot and flushed, and I know my heart is racing. Or at least it feels racing.
Okay. I could see where that would be really uncomfortable and also make you feel like you were going to be falling behind in your own work if you had sort of more social interactions going on in a busy environment. Have you ever heard of mindfulness therapy or grounding?
Yeah, I've tried deep breathing in the past, but I don't know if I was doing it correctly.
It can be used in conjunction with deep breathing to help kind of, return to having some calm and some focus. It only takes a couple minutes and can be done anytime throughout the day when someone's feeling stressed or anxious. Are you willing to try and practice it with me today for a few minutes?
Yeah, that'd be great.
Okay, all right. So when you're in a comfortable position, I'd like you to close your eyes and place one hand on your stomach. And we're going to imagine that there's a balloon inside your belly. Can you feel the balloon inside your belly?
Yes.
Okay. So when you take your next breath, I'm going to have you fill up the balloon with air over 3 counts, as much air as you can. And when it's full, hold it for 3 counts, and then you're going to slowly let the air out of the balloon over 3 counts. Do you understand?
Yes.
Okay, I will count with you to start. Ready?
Mm-hmm.
Take a deep breath in. 2, 3, hold. 2, 3, and let it out. 2, 3. Okay, let's do it again. In, 2, 3, hold. 2, 3, let it out. 2, 3. Again, in, hold. 2, 3, let it out. 2, 3. Good. Again, breathe in, hold, and let it out. One more time. Breathe in, hold, and let it out. How did you feel during that exercise?
At first, it's kind of counterintuitive to where I normally breathe. But after the first or second time, I started feeling much better. I started focusing on the numbers and breathing at the same rate. And I think at the end, I started feeling a little bit more calm.
Okay, that's good. That's good. This is one of those things that takes practice. You can also combine it with thinking about places that make you feel calm or warm or safe or comfortable, and thinking about the things around you, like what you hear and what you see and what you smell and what you feel. All of those things can be worked on together, but just focusing on that breathing in and out at the same rate can be helpful. Do you think that this is something you can incorporate into your day at different times?
Yeah, I think I can. We'll definitely give it a try.
Okay. And you can start with short amounts of like 3 or 4 at a time, or even longer periods of time, like toward the end of the day and you're trying to relax, okay?
Yeah.
And then what we'll do is in a couple weeks, we'll circle around and we'll meet and we'll talk and we'll see what's worked and what hasn't worked, okay?
Okay, sounds good.
All right. We'll see you in a few weeks, sir.
Okay, thank you.
Next, we're going to talk about acceptance and commitment therapy, also known as ACT. This pulls from multiple modalities and really helping a patient have increased psychological flexibility since introduced in 1999. It helps in identifying values in this patient's life and acting within those values. This has gained more popularity around the world in helping patients work more effectively rather than against their emotions, but there's not a large amount of data on the cultural pitfalls with this method. I think the psychiatric mental health NP needs to fully explore the cultural meaning that the patient assigns to their anxiety and how it is typically looked at within their culture with regard to expression of feelings. Some cultures may not embrace crying or openly acknowledging feelings, and this should be carefully explored to not create further issues or aggravate the original problem the patient is seeking help for. This should be a therapy that I would probably initiate after determining the level of openness or if there were any cultural pitfalls, and finding other ways to assign meaning and value with regard to the feelings that they may be having. Mr. X, welcome back. Come on in. I'm good today. How are you?
Thank you.
How have the last 3 to 4 weeks been going for the mindful therapy and breathing?
Pretty good. But sometimes, even using those techniques that you taught me, my anxiety is still present. Sometimes it feels worse. I've been trying to exercise too, but sometimes I get caught up thinking that I'm never going to get past this or it's never going to get any better, no matter what I do. So,
Yeah, I really can understand how that would feel distressing to you. Sometimes it may feel like you're moving forward but taking 2 steps back at times. Are you open to trying on another type of therapy called acceptance commitment therapy?
yeah, sure. At this point, anything that can be helpful or that we can use that can help. I haven't heard of this type of thing.
Yeah. So, kind of like the way somebody that was coming to fix a leak at your house might show up with not just a wrench, but a truck full of tools for different things and different problems they may encounter. This is just another tool that you could use in trying to fight your anxiety and deal with it, okay?
Yeah.
All right. So, up until now, we talked about things like how your nervous system works in other sessions and why you get that sort of fight or flight response, and why sometimes intrusive thoughts about, I'm always going to be anxious, I'm never going to be able to get rid of it, and some techniques like deep breathing can be helpful. The interesting thing about acceptance and commitment therapy is that it may actually seem like it's the opposite of what needs to be done for anxiety. But as we talk about it a little bit further, I hope that I can help you understand why this will work for you.
Yeah, I want to change my anxiety, but I'm not really wanting to accept that it's something that's going to be there all the time, and that it will interrupt my life. You know, I guess we'll have to figure that out as you explain it to me.
Okay. So, well, the first thing I want you to understand is that acceptance doesn't mean permanence. So, it's not a future prediction of the kind of person you're going to be or how, whether or not your anxiety is going to be persistent or high or even there all the time, okay? It's more about accepting where you are in the moment of having an anxiety issue, okay? Allowing, those thoughts and emotions to be recognized rather than trying to, fight them or push them away and make them go away. So, acceptance isn't a label either. So it's not like I'm always going to be anxious or if I had to describe myself, I would describe myself as anxious. So not future nor label, just more like in the moment right now, I'm feeling anxiety. Does that make sense?
Sort of. Not 100% sure what you mean now. Because I do label myself or think of myself as being anxious.
Okay. And sometimes when we've had persistent anxiety for a long period of time, that is one of the things that when we describe who we are and how we react, we might say, I'm an anxious person. But acceptance is really more about when you're having a moment, like let's say when you're, walking your dog and that's not helping, or you're trying to do the deep breathing exercises and that doesn't seem to be helping, that you just take a pause and you say, okay, well, in this moment, I really am feeling really anxious. But I also know that emotions and feelings come and go. They're not there 100% of the time. But in this moment, I recognize that I'm feeling really anxious. So you're not saying that you like feeling anxious. You're not agreeing with being anxious. You're just acknowledging that it's there. Does that make sense?
Yeah, kind of. Kind of like accepting someone else has a different opinion about something, even if you don't agree with them. Just being open to acknowledge that they have that opinion.
Exactly. You may believe the earth is round and I may believe the earth is flat, and we're never going to agree on which one is which, but you're open to the fact that I'm open, or that's my belief system, right? But you don't have to agree with it or like it, but you're just saying, okay, I could see where you might think that, right?
Yeah.
So it's also kind of thinking like if you've been at war for a long time and you're fighting this enemy all the time, 24/7, tooth and nail, every waking, consuming moment is thinking about this war. It's exhausting to fight it all the time. And sometimes just acknowledging that, yeah, I'm in a war and it's exhausting and I wish I weren't here. I won't always be here, but that's just where I am right now in this moment in time, okay? And that can provide some relief because even though you're fighting it, if you acknowledge it, it does somehow create some sort of peace within inside you, okay? It's like laying down the sword and fighting and choosing when to fight and when to walk away. Because you might not fight every battle in the war. You don't have to fight every battle in the war, right? It's about being pragmatic and giving yourself, space to just exist at where you're at. And that's about choice. You're making the choice to do that. And so it's that acceptance and that choice that this kind of therapy is about, okay? Because it can give you the energy to really be in this for the long haul in a much easier way. Does that make sense?
Yeah. It seems kind of paradoxical, but I understand.
Um, and just because you acknowledge it and you accept it doesn't mean you're giving up on the war or you don't have to fight for the war anymore, but it can give you the openness to learn new techniques on how to battle the war, so to speak, right? Or to learn how to coexist with your anxiety so where it's not so all-consuming for you. Does that sound like something that you would be open to working with?
Oh, yeah, that's it.
It for sure will take more practice than probably the deep breathing and the calming techniques. But there's also a third analogy I like to use to kind of help people is that, during times of grief, you have to accept that there's a loss before you can move on through the stages of grieving, right? Because if you don't believe and accept that you've lost something or someone very important to you, you're still going to be fighting with it. before being able to deal with it. So that's, it can kind of help you move forward in the direction by at least accepting it. Okay? All right. What are the ways you think you could do this at home outside of talking to me? What are the things you could do to try and embrace and accept this?
Well, I can, I guess, try to embrace that feeling that it's happening. I guess I could. Are you talking like what other techniques I could do to augment this? I guess I could do like journaling or writing, maybe doing some self-talk, making sure that I say, I'm feeling really anxious right now, but it's okay. It will pass. I'll be okay. It's okay to be mad and tired and panicky right now, but I can get through this. Just keep reiterating that it's just doing it, going through whatever is happening. Um, Maybe that way I'll have some control over it. Just commit to the process.
Yeah, that's a good start. Okay. So again, kind of like we have been for the last few weeks, let's have you have some opportunities to practice this, and we'll circle back and we'll talk about what works and what hasn't worked, okay?
Yeah, thank you.
All right. Method 3 that I have chosen for this patient was interpersonal therapy. This focuses on social roles and relationships. In IPT, this patient will work with the psychiatric mental health MP to identify any interpersonal issues they may have, such as unresolved grief, conflicts with families or friends, changes in work or social roles, problems relating to others, and then they learn healthy ways to express emotions and improve their interactions and communications with others. There can be cultural and lifespan issues related to interpersonal therapy. One may be attrition because it usually requires several sessions to fully explore the issues related to the original reasons the patient may be seeking help. Financial ability may also be another pitfall. Cultural, familial, or religious community responses must be taken into account, and if family are willing to help explore this with the patient, it may be helpful, including having the patient explore finding support for counseling through their religious community leaders. Additionally, more complicated problems may be uncovered through IPT that may require a change in treatment modalities depending on history and factors that are uncovered in the process. There may be particular cultures such as Hispanic or Asian that may view therapy in the traditional sense as a personal weakness. There may also be medical distrust for some cultures given previous history of treatment or require a provider within the same culture as seen with some persons of the African American or Black culture. I think these questions can be felt out, and asking of preferences in a gentle manner to which we need to be sensitive and accommodate patients if we can. In this personal interview, we will be working on finishing out the interpersonal therapy sessions that have been going on for several months on an every other weekly basis with Mr. X. A brief overview of the past sessions will be reviewed, and then we will focus on closing out the therapy. Mr. X, welcome back. Good to see you again. How have the last 2 weeks been?
I think we're getting better. I feel like I've been getting a lot more out of these sessions. It's helped. It kind of helped me figure out maybe what's the roots of some of my anxiety and some of my behaviors.
Okay. Is it okay if we just recap those sessions for a moment or two before we move on?
Sure.
Okay, great. Initially, we worked on some techniques for when you feel anxious, and for the last few months, we've been working on some of the possible reasons that the anxiety might have occurred to begin with. What your role is in that, working on some problem-solving strategies, and right now we're moving toward possibly getting closer toward deciding if you need to continue therapy. Does that sound about right?
Yeah, it does.
Okay. A couple of months ago, we transitioned into talking more about taking a personal inventory about the key areas of your life that required more attention. Can you remind me of some of those?
Well, I was having some issues with relationships at work and at home because of my stress and anxiety. It was the stress and anxiety being high is what I mean. I was avoiding social occasions and even work at times because I felt overwhelmed and couldn't concentrate on my work. I would say I was a little passive aggressive in that I would not help people that I found annoying or avoidant to my family members at times.
What were some of the key people and relationships that you identified as the most important ones that you wanted to work on?
Definitely my family and my boss, my colleagues. I think.
What about your relationship with yourself?
Yeah, me too. That too. That's probably the most important, I think.
Okay, so let's recap some of the problems that we identified together.
All right. I'm not great at expressing my needs or my emotions. Sometimes I feel like I'm not enough just being myself with my peers and my family. I'm sometimes negative instead of positive, and my coping mechanisms, like eating fast food, avoiding exercise, avoiding doing the things I enjoy. I also have trouble with transitioning my thinking quickly. So,
Okay, like at work, kind of, when you're being asked to do one thing and then another.
yeah, definitely.
Are you open to maybe doing a short role play regarding that?
Sure, yeah.
Okay. So in this role play, I'm going to be your direct supervisor. All right.
Okay.
It's a really busy day and you've got a lot on your to-do list. How would you handle this request that I'm going to make of you? Mr. X, I'm going to need you to stop working on Project A and assist another employee with their work because they're really behind.
First of all, I gotta start out with a couple of calming breaths, because that would totally throw me off. Um, I think that it will be difficult, is what I would say to my boss, for me to do that. I have multiple projects, deadlines that are due in the next few days that are vital to this company's bottom line. If I put off the work that I've scheduled, it will create the same problem in another area. The work will be behind schedule, and this can affect both the profits and the customer relationships.
Okay, I hear what you're saying, but this other project is more important than the one that you're working on.
Hmm. Can I ask you why you think this is so? Maybe there's a misunderstanding regarding the work that has been delegated to me already, and maybe you could also provide me clarification on what the issue is specifically with the other project. Are you asking the other project you're asking me to help with?
Okay, well, employee Z came to me and said they've not been able to kind of fully flesh out the budget for their project, which is pushing back the remainder of their project timelines because they weren't able to get all the market information needed to make the budget.
Yeah, I could see how this could be worrisome. When is the budget deadline?
In about a week.
Okay. So I see your urgency and their need, but my project is due this Friday. I do have my assistant who I could direct to help do some market research for the budget that Employee Z needs for the next 2 days, and this would allow me to finish what I need to do. Would this be helpful?
Yeah, I think that actually could be a good idea. Let's see how it goes. I don't want uh, either project to run behind, but yeah, that could be helpful.
Okay, thank you. I will communicate this to my assistant.
All right, that was good. How did you feel about that?
Um, I feel good because I expressed how I felt. Um, I Most of the time I would just agree and kind of grumble and or be internally stressed out and angry. But I was able to express myself more.
Do you feel like being able to identify and expressly and effectively communicate your needs is helpful to you?
Yeah, definitely.
Do you feel like we need to work on other areas and continue to meet, or do you feel like you can take those examples that we've worked on over the last few months and the other types of therapies and sort of incorporate them into your day-to-day to see if you can manage your anxiety better?
Yeah, I think right now I feel like I have a lot of tools that will work, and I can start practicing them more. I think I could back off on therapy because my relationship with my family and colleagues has gotten better, and I feel less stressed. I'm exercising more, eating better. Could I come back and start again if I have some more problems and more anxiety?
Absolutely, absolutely. This is sort of a process that's driven by you. Um, let's sort of take a break in the sessions right now, but leave the possibility open of coming back together down the line if you feel like, you know, you need more assistance or guidance or other issues have popped up in the meantime.
That sounds great. Thank you
Okay.
very much.
It's been a pleasure working with
All
you,
right.
sir.
Take care.
Okay. So I picked these particular therapies with a short, medium, long-term goals in mind for this patient. The immediate assistance of the DBT and deep breathing exercises with mindfulness can create immediate intervention tools that the patient can use in times of stress and anxiety. I felt that the acceptance commitment therapy could help the patient come to terms in the early to mid stages of learning how to live with the anxiety and not fight so hard against it in such a way that it creates a circular effect of worsening their anxiety overall. And I do feel that the longer interpersonal therapy was chosen to really try and help the patient identify root causes and effects, and then determine specifically how they might be able to resolve some of those challenges to improve their overall relationships in life and manage and treat their anxiety. The overall expectation that I would have for this patient is that given the patient's history obtained in the first visit and how he responded to the types of therapies that were incorporated, that he's a good candidate for short-term therapy, and if needed, he could come back and have sequential visits as needed if any particular issues arise or other things that he finds that he would like to work on in his life. That's the end of this presentation. I hope it was helpful for you. Um, and again, my name is NURU642 NJaeger, and I'm with the University of Massachusetts Global.